Is that improving? Is the promise of that turning out at all?
I always am put off by people's fascination with N=1 medicines. 500,000 kids die of malaria. Millions of people are diagnosed every year with Alzheimer's. So I'm just the impersonalized medicine guy. Yes. I'm like, the world does not have the resources to do N=1 solutions. If some super rich person, funds that, maybe it helps the scientific discovery path, but, I couldn't bring myself to be involved with that because it's so unjust to take finite resources. Eventually, yes, understanding everyone's genetics and saying, okay, your drug dose is different because of this. And so, I'm kind of taking a provocative position on this. The science that goes under that name is very good science. The people who work on that are very well intended. It's just, we have rare diseases. We've created such an incentive for them versus widespread conditions. We're not really allocating that effectively, particularly, the insane stuff is the diseases of the poor countries.
So can you actually say more about, you've traveled recently, Africa, Asia, all over, about the conditions with healthcare workers on the ground? What have you seen there and how can we help improve them?
Well, people should understand that most people in sub-Saharan Africa never meet a doctor. Not when they're born, not when they're sick, not when they die. And so this is not a doctor's thing. So your image of healthcare for most people in those countries is primary healthcare. A modestly trained person who can give you some antibiotics, bed net, vaccines, very, very importantly, to give a pregnant woman their prenatal checks.